Well, good afternoon. For the past few weeks, we've stood here and made a commitment to do everything in our power to reopen every region of Ontario safely and gradually. And throughout the course of this pandemic, we faced challenges and roadblocks. But each time, we worked with our partners, the healthcare workers, volunteers, and medical experts to take quick and decisive action. We addressed the issue head on, and for every challenge, we gathered our resources and we got back on track. Because as I said from the beginning, the only way we'll beat this virus is if we stick together. Today, Cabinet will convene with the intention of allowing parts of Windsor-Essex to open. With the exception of Leamington and Kingsville, Windsor-Essex will move to Stage 2 tomorrow, effective 12:01 a.m. on June the 25th. And right now, we need to work together to support the rest of Windsor-Essex so that all of Ontario can get back on track. The outbreaks at our farms is a new challenge, and it requires a targeted response. Today, we're launching a 3-point plan to help the rest of Windsor-Essex move into Stage 2. As a first step, we have expanded testing on all farms, starting with the largest ones. Matt Anderson and Dr. Huyer and the team at Ontario Health have been working with local hospitals to send the mobile testing units to the farms. We're bringing the testing right to their doorsteps. Anyone who needs a test can get a test. And I want to thank the farmers, I really do. Thank you to the farmers for their help. This is the only way we can contain this virus. And that leads to the next point of our plan. I want to send a clear message to the temporary workers. No one will lose their job if you have COVID-19. No one will be sent home if you have COVID-19. And if you test positive for COVID-19 and you need to self-isolate for 14 days, you will be eligible for WSIB benefits. And in some cases, if you worked here last year and you have a social insurance number, workers may be eligible for the federal CERB benefits. Our temporary workers have access to the same benefits and protections as any other worker. We stand shoulder to shoulder with our farmers and our workers. And we're here to support the essential workers who come here every year to help put food on our tables, because we're all in this together. I also understand that our farmers are often on the seasonal schedule, and this is one of their busiest times of the year. They need the extra help, and unlike other professions, most of it is outdoors and isolated. So to further support our farmers, the third pillar of our plan is a new public health guidance for asymptomatic workers. This guidance was developed in consultation with Dr. Williams and his team of experts. This new protocol will give farmers guidance on isolating workers who have tested positive for COVID-19, but who have no symptoms and who can still safely work outdoors in isolation. With the support of our farmers and workers, the rest of Windsor-Essex can get back on track so all of Ontario can reopen and get back to work. And we'll be there every step of the way to look out for our farmers, to look out for our workers, and make sure our economy comes roaring back stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Since the start of this outbreak, it has often been said that we are all in this together. The steps we are taking today to build on and support the work of the Windsor-Essex County Health Unit reflect our commitment to the health and well-being of all Ontarians in all parts of the province. We know that testing on farm sites is challenging and that there are many variables that make it difficult. By providing both farmers and employees with economic certainty, this 3-point plan will allow the rapid scaling up of testing in agri-food sector workplaces across the region. As we do, we can identify and isolate cases of COVID-19 and help put a stop to further spread of the virus. Taking these targeted actions and building on our collaborative and comprehensive response already in progress will help this region to be ready to move completely into Stage 2 and safely reopen. And I do want to strongly recommend that everyone in Ontario please continue to follow public health advice including maintaining physical distancing, wearing a face covering of physical distancing is a challenge, and practicing hand hygiene. These are the most important things we can do to protect one another so that we can all come through this together. Thank you. And now I'll pass it over to Minister McNaughton.
Thank you, Minister Elliott, and good afternoon. As the Premier announced, Ministry of Labour, Training and Skills Development inspectors are beginning a new round of inspections today. They are teaming up with federal inspectors and local public health officials to conduct the first joint inspections on farms in the Windsor-Essex region. Inspectors will look at workplaces and living quarters, which is key, because provincial inspectors don't have jurisdiction over the bunkhouses. These new inspections are just one more way our government is ensuring its workers are healthy and safe, regardless of their nationality. Because in Ontario, migrant workers are entitled to the same benefits and protections as any other worker in this province. That includes safety and insurance benefits, which are administered by the WSIB. It also includes protections afforded by the Employment Standards Act. A worker's passport does not determine how they are treated in our system. That's not the Ontario way. The law in this province is clear. Employers must take every reasonable precaution to stop the spread of infectious diseases like COVID-19, and there are stiff penalties for anyone who doesn't follow the law. As we know, the vast majority of employers in this province are doing a great job. To all of you, keep up the good work. The adjustments you've made haven't been easy, but they are critical to get Ontario back to work safely. If you are an employer and need more help adjusting to the new conditions, please check out the nearly 200 resources we have posted at ontario.ca/COVID safety. These resources have been translated into multiple languages, including French, English, and Spanish. And if you are an employer that is not taking this situation seriously, there will be consequences. To successfully reopen Ontario, we need everyone to do their part to protect the health and safety of workers. The connection between workplace safety and our economic success as a province is crystal clear. That's why we all must do our part together. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Brian Cross from Windsor-Essex. Please go ahead.
Hi, Brian.
Hi. Could you please explain that third directive? Did I get it right that people who are asymptomatic but are COVID-19 positive, that's how you deal with those guidelines for dealing with them?
Yes, that's correct, but I'll pass this to Dr. Williams.
So when we originally started doing asymptomatic testing, we put out guidelines that if you find an asymptomatic worker who is positive but has no history of contact or other risk factors, we found ways that the person could separate themselves from the other members of the workforce, work on the job if that was permissible by the employer, and continue to do so until we monitor symptoms, and if they develop any, that's one thing, and to get retested. Because sometimes we find some people who were already resolving, if you retest them again, they become negative. And so we saw that as a false positive in a sense, positive lab test, but a negative one as far as clinical impact. We found out on this event here, it was the first, we had a cluster of asymptomatic workers who tested positive. So we put out a cluster method where you could take those individuals who are asymptomatic and are still test positive and ask them to work separately from the rest because they're mostly on farms, they're out in large acreage. They can, daytime, have no problem. They would wear facial covering, of course, and then how the farmer would work to have them sleeping in separate together, away from the rest of the workforce and from eating and etc., so they're not interacting with the rest of the workers. We would monitor them. We would retest them within 48 hours, and if any developed signs or symptoms, we would have to deal with them as possible cases. If they turn negative, they could resume their duties and go back and work with the workforce, the same as the rest. So it was an adjustment to our previous policy because we hadn't seen this cluster type picture of a group of asymptomatic workers in one location that were test positive but asymptomatic.
Follow-up?
Yeah, is this unusual? Like, has this been done anywhere else where non-migrant workers, a cluster of them test positive and they work in any case?
Ontario is one of the first provinces to do a lot of asymptomatic testing. That's what Dr. Huyer has been undertaking in various settings, including on farms, some in workplaces. So as a result, we haven't got a lot of information and science behind this in Canada. So we're one of the leading ones in doing that. So in a way, we're breaking new ground on that, understanding what the tests mean, because you may have a positive test, you may have already resolved from a previous infection, and if you have any just remnants of even dead virus or parts and bits and pieces, our test is so sensitive, it'll pick that up. But of course, if you wait for a day or two until it clears, they would turn negative again. So we're learning more about our testing, how that fits in the overall clinical picture, and when cases are resolving, some people can keep some in their nasal passage for a period of time, even though they're no longer infectious or are infected at that moment. So as we learn more, we change things, we adapt, and we discuss this with our federal, provincial, territorial partners.
Next question.
Next question comes from Christine Elliott from AM 800. Please go ahead.
Hi, Christine.
Hi, Premier. I understand you're coming down here for a haircut now.
Yeah, I am. You know something, well, once we get Leamington and Kingsville, Christine, and we're going to work together, and it's amazing when you work together and everyone's kind of pulling in the same direction, how we can get this resolved. And I'm so happy for the people of Windsor. This was weighing on my shoulders, but everyone cooperated. I want to give a shout out to Dr. Ahmed too, and Mayor Dilkins. They're working their back off, and we ended up knocking down the barrier.
Okay, my real question now. I understand that an inappropriate comment was directed at you this morning from one of our NDP MPPs in Windsor-Essex, and there has been some backlash on Twitter that the comment is not doing Essex County any favors, and I'm just wondering what your response to receiving that comment was this morning in the legislature.
No, you know, some was water off a duck's back. I'll tell you, I've never heard anyone swear, and over 200 times I've been in the house. You just don't do that. But, you know, it happens. I forgive the guy. Let's just move on. My main focus is I want to protect the people of Essex. I love the people there. They're, you know, salt of the earth people, and so is Windsor. That's why we're doing everything we can to make sure we open up, which is great news, and I want to thank the team for doing that, led by the Minister of Health and Dr. Williams, Dr. Huyer, and Matt Anderson. Everyone pitched in, and it's amazing. Like I always say, every time we hit a hurdle, we seem to get the troops together all around, not the government per se, but everyone involved, the stakeholders, and we end up getting through it. So I'm just so happy, and the folks in Kingsville and Leamington, we're throwing out every resource to get you back on track very, very quickly.
Follow-up?
Yes, and so I wonder then, for those people in Leamington and Kingsville, it might be difficult for them to not try to book a hair appointment or some type of appointment in Amherstburg or LaSalle or in the city of Windsor. So what's your message to them, and how will you, stop them, or will you try to stop them from going into other parts of Windsor-Essex for these appointments?
Well, there's no way of stopping anyone, and I've always said I don't like the so-called police state that if you go there, go there. We're just trying to protect the workers and the farmers. That's where it's really focused on, and not so much the general population. And we're going to get them to the next level as quickly as possible, because they're great folks out there, and I can't wait to go down there, by the way, and get this bushy haircut taken care of.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Allison.
Hi, Premier. I'm hoping you can touch on the expanded testing bit of your three-point plan a little bit more. Is there something new in the testing regime that you're announcing today, or more the sort of focused mobile testing that you had been talking about before? And how is that going? Are you getting any more cooperation than you have been in the past?
Yeah, and I got to send it to the expert, Dr. Huyer, as we always call him, Dr. Dirk, but this guy's a champion. I can tell you that. So I'm going to pass it over to Dr. Huyer.
Thank you, Premier, and good afternoon, everybody. So thanks for that question. The farmers and the farm workers have been engaged in these discussions throughout. We started doing some testing and offering testing following recognition that there were some farms that were struggling with infections. And throughout, we've been engaged in conversations with the farmers. They've provided feedback to us about the approaches that we've taken, and we've listened, we've learned, and we've responded. Dr. Williams worked with the local medical officers of health across the province in thinking about strategies, as he talked about, groundbreaking in Ontario. And those were questions that those were things that flowed from the questions that the farmers and the employees asked. So what we've done is we've built an additional capacity for on-site testing. We continue to have the availability for an assessment approach that's based and people can come to. And we're really working with the farmers and the farm employees to provide the best service possible to do this as quickly as we can. So I think the additional things are additional perspectives from Dr. Williams, additional capacity for on-site testing, and continued engagement with OMAFRA. So the ministry overseeing and working with the farmers, as well as great engagement from the associations that work with the farmers, as well as the farmers.
Follow up?
Okay, I see here that the news release says that about 350 asymptomatic workers have been tested since on-site testing launched this past weekend. So is it now 350 plus the 700 some odd who were tested before? Because that's really still just, about 1,000 workers out of the 8,000 in the area.
Yeah, 1,000 workers seems to me to be a large number, and really hats off to the farmers and hats off to those employees that attended, and also to the hospital staff who mobilized out to on-site work where it's hot. All of the workers are taking time from their work, and the employers have pulled them together to be able to allow this testing to occur. For me, 1,000 is a lot, and we're working to continue to do all of the workers that are in the area. We mobilized just starting Saturday for more additional on-site work, and so we're scheduling and we were working on that yesterday. Multiple phone calls I was on working with OMAFRA as well as others and farmers. Great questions, great conversations, and we're moving along very quickly to support the farms.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, question first for the Premier. We've noticed that there's been long-term care facilities that have had outbreaks. They get named, but you're not naming or you're not mandating that the local health units name the farms that have had COVID-19 outbreaks. And you've also talked about how some farms are not cooperating with testing the workers. Some farms are, but some aren't. So wondering, why are you not naming the farms that are failing to cooperate? And why is the province not requiring that the farms that have outbreaks be publicized?
Well, first of all, Mike, we're comparing apples and oranges. The farms versus long-term care, it's night and day. And I want to give a thanks to OMAFRA. They've been on every single call. They've been working hard. The Minister of Agriculture has been working hard, along with the Minister of Labour and Minister of Health, and we're just working together. You got to walk a mile in their shoes, and none of us have. Just imagine you have a business, a farming business, which is tough at best of times. You're working your back off. You could lose your business in a few weeks, your lifelong passion, and you could lose $25–50 million just bang, gone. So we got to protect the farmers. They put food on our table, and then we have to protect the workers there too. They've come from a different country to jump in there, and they do it every single year. There's well over 11,000. Sometimes it'll peak up to 16,000 in the fall as well. These people mean no harm to Ontario. They're trying to help us. And the farmers are just phenomenal people. Man, like These people work their backs off, and I'm there to protect them, not to hurt them. So I don't like naming farms. Everyone's on side now. Everyone's working together, and again, it's amazing, Mike, when everyone's pulling on the same rope. Everyone comes up with a solution, and that's how we're able to open up Windsor. That's how we're going to open up Kingsville, Leamington very shortly once these numbers come down.
Follow up?
On another topic related to actually long-term care, we've had a number of families that have come forward with stories of neglect in the lead up to the pandemic, or in the lead up to them, these folks dying in long-term care during the pandemic. Does the province have any plans to get those people, the relatives of those folks who were neglected in long-term care, involved in the investigations that are going on into how the crisis is handled?
Well, it'll be a public commission, so as the commission moves forward, people will be able to come out and tell their story. I want to hear the stories. I've heard a lot of stories, mind you, but I want to hear their stories until it never happens again, and we never see the pain with the families, Mike. So yes, they'll be able to come in and tell us the stories.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Hi, Premier. Thank you. I just want to follow up really quickly on Mike's first question there with regarding to farms, because we've seen certain issues that you came down hard on, the price gouging in the past, and obviously people are reporting those types of things. So I'm just curious if we're continuing to see certain bad actors, certainly not a lot of them. I'm just curious. What in your mind would it take for you to come out and name a particular farm that is not kind of abiding by the rules? How bad would it have to get?
Well, the only time I name people is when they purposely try to gouge someone or hurt someone. Farmers not out there to hurt someone. I can assure you that. They're there to help people. But I'm going to pass it over to the Minister of Labour, and he can talk about that.
Well, thank you very much, Premier. Look, we know most of the businesses in the province are going above and beyond to protect all of their workers in the province. What we've done as a ministry, specifically leading up to the current situation on farms, is send inspectors in. Almost 300 inspections to date. We've issued 79 orders to improve conditions. As I announced on Monday with the Premier, we thank the federal government for stepping up. Their responsibility is to inspect bunkhouses, and they partnered with us and local public health officials to go in to improve the situation for those workers. Now, when it comes to identifying those farms where there's problems, there's been a number of media stories locally in southwestern Ontario. I represent a riding where there's lots of these great farmers and lots of these migrant workers. But I want all of those workers to know they are protected by the law here in Ontario. We will protect them. We're going to work every single day to improve the conditions and also work with farmers to better improve the health and safety conditions on every farm across the province.
And Premier, thank you. And Premier, as well, in terms of, you just mentioned a second ago the price gouging. I'm just curious where we are on that, if we've moved past the investigative stage and kind of into the fines world. And if I could squeeze one other one, as we see more businesses opening up, obviously during stage 2, and we see more businesses including COVID-19 charges, to recoup lost wages. What do you think of that generally? Are you in favor of that? Do you understand that? And when would that go too far?
Well, I don't know about COVID charges. Let the market dictate. If you go into a store and something's a little bit higher, not being gouged, just a little higher, then shop around. The companies have to survive and make a fair margin, but people are smart, really smart, especially when it comes to shopping. They know when they're getting gouged or not. They don't need a flyer to tell them that. But I think everyone's doing a good job, and we're going to move forward together. I'm just so proud of Ontario. I really am. The people and the businesses are amazing, just incredible here. in Ontario.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy. I looked into your question, by the way, which I always do, about the patios, and so the city gave us a call and said there was 3 patios that backed onto the residential side, and they're trying to work with the residents, and hopefully they can get that ironed out. But good question yesterday.
Okay, thank you. Today, I'd like to ask about migrant workers. We've had reports, some of these migrant workers are getting out of quarantine after 14 days. They're out and about in the community just being parts of the community. Yep. We've had reports of racist slurs being yelled at migrant workers in Brantford. I'm wondering if you're worried about that spreading.
Hopefully, yeah, Randy, hopefully not. I just won't tolerate that for a second. Folks, let me tell you something. I think majority of the people, vast majority, 99% of the people would support this comment. And we have zero tolerance for any racial slurs. Let me tell the people that ever have a racial slur, those vegetables you're eating is because of these migrant workers. Those fruits that you're eating that we can grow in greenhouses because of the migrant workers. And if you don't appreciate the migrant workers, then you go out in the fields and start working your back off when it's 100 degrees out in the middle of the summer. These people are good people. They aren't here to hurt anyone. They're here to help us make a few extra dollars, and I'm just dead against that. So if you see a migrant worker, matter of fact, maybe you should go up and say, thank you for working your back off, because a lot of people aren't willing to do the work that they are doing. And that's the reason we call them in. So I'm grateful for them. And remember, Randy, they never came here with COVID-19. They all self-isolated. The people here, somewhere, somehow, gave them COVID-19. Then it spread in congregate living. So I appreciate the work they do.
My next question is about back to the beaches. Crystal Beach says that they're going to open a beach, I guess tomorrow, and they're going to restrict people that can use the beach to residents of Fort Erie. Is that something that makes sense to you, that beaches be restricted to people that live near them?
Well, that's a tough one, Randy. Beaches should be available to anyone, but I understand they had a pretty wild time on the weekend, and all the people that go to the beaches, just remember, be responsible. Make sure that you stay 6 feet away from someone else, unless it's within your social bubble or group. But we all have to be responsible and respect the land that we have here in Ontario.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Cynthia.
Hi there, Premier. How are you today?
Good. It was great to see you in the house today. I haven't seen you in months.
My first time there in 3 months. It was very quiet, though.
That Benzie's really sporting a good tan, too. I'll tell you. He's looking sharp. So
my question is about long-term care, Premier, and I've noticed in looking at the data that in the past 2 weeks, there have been 41 new long-term care outbreaks. In the prior 2 weeks before that, there were only 14. Is this a huge concern that's being watched carefully as visits are starting to open up? I've also noticed that 227 staff have been infected. So what's going on here?
So it's always concerning, and we're watching like a hawk, but I'm going to send it over to the expert, the Minister of Health, and she'll be able to answer that. Thank you.
Well, it is a concern whenever we see the numbers going forward, and especially with respect to long-term care homes, because the populations there are so vulnerable. It is perhaps a reflection of the gradual reopening of the economy, which we're watching very carefully. I know that Dr. Williams watches it carefully, as does Dr. Huyer. But we need to make sure that as we reopen, that any impacts are assessed and that we make any changes as necessary. But allowing people to come to see their family members when it's outdoors, when people have been tested in advance, is really important. We've heard that from both the residents in long-term care as well as their family members. So as long as it's done with the right physical distancing and as long as people have had the testing done in advance, we don't anticipate an increase in the number of cases. But it is a group we are protecting very carefully.
Thank you, Minister. And for a follow-up for you,
a lot of families are saying that when they go for their visits, they have to show the long-term care home physical proof that they tested negative, and yet your ministry has confirmed with me that they don't have to show physical proof, that they only have to give verbal verification that they've had that test. So has it not been communicated properly to long-term care homes that they don't require physical proof of a test, or are some being too strict?
I'm going to refer that one to Dr. Williams, Cynthia. Thank you.
I'm going to step in for Dr. Williams as it speaks specifically around testing. I can say that we're working closely with the Ministry of Long-Term Care, and there was, as I understand it, recent update information to help the homes understand how this is to be applied. In the policy, it says attestation, so which may have potentially caused some confusion. Essentially, it means that the person who is attending does say that they were negative. It does not require the document, and I think people have interpreted that differently. It is my understanding that the Ministry of Long-Term Care, who has made the testing decisions, has updated that information and provided that clarification.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. Some migrant workers on these farms have described some pretty horrendous living conditions, not just in Windsor-Essex, but other parts of the province. They say they've been treated like animals in some places. So what are you going to do to ensure that these people are treated properly? And if the government is stepping up investigations, what are the consequences going to be for these farms other than issuing orders? What kind of consequences will they face if these workers are not being treated properly?
Well, the Minister of Labour put in a lot of guidelines and orders, actually, to follow. I'm going to pass it over to Monte.
Well, I can promise every worker in the province, including those in the agricultural sector, that we're going to enforce all these rules to protect all of these workers. They are heroes, like the Premier said. I mean, they are the reason why we have food on our tables. And every employer in the province knows the legal ramifications of breaking the law if they're not protecting their workers. I mean, the maximum fine is $1.5 million and potential time in jail. Obviously, that's not what we want to see happen. We want all businesses to go above and beyond, which, as I said earlier, most of them have done, to improve conditions for workers, to in some businesses to ensure that customers are coming in and feeling safe. But we're on the ground, we're in the field every single day. As I said, nearly 300 inspections, 79 orders, and as you know, Laura, the federal government has responsibility for the temporary foreign workers programs and the inspections of bunkhouses, and I'm glad that they have now partnered with us and local public health units to improve conditions for these very, very important people and workers.
Yeah, Laura,
Thank you.
if any workers being treated that way, just call my office. We'll be onto it, but we are going to continue the inspections. And most of the farmers that I've went to, I've visited a lot of these farms over the last couple of years. They value their team, just like any company. The most important thing of any company, no matter if you're a farmer or not, protect your workers, take care of them. They're the ones that can either make you or break you.
Thank you. And Premier, I wanted to ask about the Vaughan Working Families Group, who released those ads slamming teachers' unions back in February. Okay. The Chief Electoral Officer says that there was an apparent contravention of the Election Finances Act. Can you comment on whether you had any connection to these ads, given a PC appointees on the board of directors for this group?
I had nothing to do with that, but I guess it's at the AG's office, and we'll see what happens.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Robert,
hi, Premier.
I have to smile. I'm sorry to interrupt you, but you look like a California surfer today. You must have been hanging out at the beach there.
Well, you know what, I am a naturally handsome fellow, Premier, as you know, so I guess and I've been spending a lot of time outdoors. I just wanted to follow up on what Laura was asking about this situation with the Vaughan working families. I know that you've said that the party had nothing to do with this, but the person who is now being investigated by, or I guess could be investigated by the Ministry of the Attorney General, is a Conservative appointee. You appointed him as the vice chair of the LCBO. So I'm just wondering if that appointment will be rescinded or if there will be some action taken, given that the chief electoral officer has said there was a violation of campaign finance laws.
Yeah, I'm just telling you honestly. If someone gave me $1 million right now, I don't even know a person's name, but they'll deal with it. And an appointee, I appoint probably 3,400 a year. They send me these pieces of paper, make sure they've done their due diligence. I sign off on it, and away it goes. It usually comes from the ministry, but it's in the AG's office right now.
And another subject, Premier, we've seen, we have a story in the Star today by my colleague Victoria Gibson about a homeless person dying under the Gardiner Expressway. We have 20 people camping out in city parks right now in Toronto. More than 20 people, 20 people in Trinity Bellwoods Park alone, apparently. Yeah. I'm just wondering if you have concerns about this. Steve Clark said in the House today that the government has spent a lot of money, given a lot of money to municipalities to help with the homeless crisis, and here we have, people living and camping in Toronto parks. I mean, what do you think about that? How does that make you feel?
Yeah, something, Robert, I'm going back to the days when I was a councillor, and no matter what administration's in there, especially in the summer, people don't want to go into these shelters. They don't like the shelters. They don't like staying there. They say some people get beat up, their stuff gets stolen. They'd rather put a tent out in a park, but guys, you can't do it in a public park. You just can't, and you can't be doing it underneath the Gardiner. Number one, I think it looks terrible. We have tourists from around the world, not now, but when we did before, you just can't do that. And I understand you want to stay outside in a tent. It's probably better living quarters. But that's an ongoing issue. Just don't hang out in the parks. Simple. I wish I could tell you where to hang out, but I know it's tough in these shelters. In the winter, they have to go in the shelters just to make sure that they stay warm. But we're giving the money to the municipalities, and we're going to be giving more money to the municipalities to help out. And this is my comment back to the federal government. The amount they're giving for the entire country just doesn't cut it. They've been really good, by the way, the feds. But guys, we need some more money, and we're gonna make sure we put our money where our mouth is too, and give the municipalities a substantial amount of money, right up to our capacity.
Okay, that's all the time we have. Thank you.
Anyways, thank you so much, everyone. Thank you.